Is ADHD a form of autism? No, ADHD, attention deficit/hyperactivity disorder, is not a form of autism. Although there can be some overlap in symptoms and individuals can have both ADHD and autism, known as comorbidity, they are distinct neurodevelopmental disorders with separate diagnostic criteria. ADHD is primarily characterized by symptoms of inattention, hyperactivity, and impulsivity. Individuals with ADHD may struggle with maintaining focus, organizing tasks, managing time, and regulating their behavior. ADHD affects various aspects of life, including academic performance, relationships, and daily functioning. Autism, also known as autism spectrum disorder, ASD, is characterized by persistent deficits in social communication and interaction, as well as restricted and repetitive patterns of behavior, interests, or activities. It involves challenges in social interaction, communication, sensory processing, and the presence of repetitive behaviors or restricted interests. While there can be some similarities in symptoms, it is important to note that ADHD and autism are distinct disorders with different diagnostic criteria. They have different underlying causes and may require different treatment approaches. A comprehensive evaluation by a healthcare professional experienced in diagnosing neurodevelopmental disorders is necessary to accurately assess and differentiate between ADHD and autism or determine if an individual may have both conditions. Why is ADHD commonly underdiagnosed in girls and children assigned female at birth? ADHD, attention deficit/hyperactivity disorder, is often underdiagnosed in girls and children assigned female at birth for several reasons. Presentation and symptom differences: boys with ADHD often display more hyperactive and disruptive behaviors, which are more noticeable and align with stereotypical expectations of ADHD. On the other hand, girls with ADHD tend to exhibit more internalizing symptoms, such as daydreaming, inattentiveness, and being quiet or withdrawn. These symptoms are often overlooked or attributed to other factors such as shyness or emotional problems. Socialization and gender expectations: girls are often expected to be more compliant, organized, and focused than boys. When girls with ADHD do not meet these expectations, their symptoms may be attributed to personality traits or developmental differences rather than ADHD. Girls may also employ coping strategies such as increased effort, masking symptoms, or seeking social approval, making their ADHD less apparent. Diagnostic criteria bias. Historically, ADHD diagnostic criteria were primarily based on studies conducted with boys, leading to a male-biased understanding of the disorder. The criteria may not fully capture the unique presentation of ADHD in girls, resulting in underdiagnosis or misdiagnosis. Mental health and comorbidities. Girls with ADHD are more likely to have comorbid conditions such as anxiety, depression, or eating disorders. These additional challenges can overshadow or mask the underlying ADHD symptoms, making diagnosis more complex. Systemic bias and stereotypes. There is a pervasive stereotype that ADHD is predominantly a male disorder, leading to a lack of awareness and recognition of ADHD in girls and children assigned female at birth. This stereotype can influence healthcare providers' diagnostic decision-making and contribute to underdiagnosis. To address the underdiagnosis of ADHD in girls and children assigned female at birth, it is crucial to raise awareness about the unique presentation of ADHD in these populations. Healthcare providers should be educated about the potential gender differences in symptoms and manifestation of ADHD. Parents, educators, and healthcare professionals need to be vigilant in recognizing and evaluating ADHD symptoms in girls and children assigned female at birth, ensuring that they receive appropriate assessment, diagnosis, and support.